Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Ballman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo Outpatient Program. Thanks for joining us. Today we're talking about schizophrenia, so we'll open up the discussion. First of all, what are the symptoms of schizophrenia?
Well, schizophrenia is considered a psychotic disorder. It's a very serious, very significant mental health disorder that involves both positive and negative symptoms.
There are a lot of misunderstandings about schizophrenia, so people commonly think about it as split personality, which is not the case. The hallmark of schizophrenia is psychotic symptoms. And what psychotic means is that a person is experiencing things that are not based in reality. They may be perceiving things, for instance, hearing voices or seeing things that are not there. They may be believing things that are not true, that people are against them, or that there's some reason to be paranoid. Whatever kind of experience is not based in reality is a psychotic symptom.
So how common is schizophrenia?
The prevalence is about 1% of the population, and that's held pretty standard, I believe, for a while.
And that's true across cultures. Schizophrenia is considered a major mental disorder, meaning that if you look at the range of types of mental disorders, this can be one of the most disabling mental disorders.
These are the people that sometimes we think of when we see homeless people, perhaps, that seem to be totally out of touch with reality. As Dr. Erickson mentioned, those thoughts that aren't consistent with what's really going on, feeling paranoid, or perhaps having other types of delusions.
What is psychosis?
Psychosis is when someone, and that's a pretty broad term, you can have hallucinations. For the schizophrenic, they're primarily auditory hallucinations. There are other types of hallucinations involved in psychosis, including visual hallucinations or even olfactory hallucinations, meaning you smell something that's not really there.
Sometimes people have disorganized thought, and that's also considered psychosis. They may not be able to organize or complete their thinking. They may feel that other people are controlling or influencing their thinking. And all of these different kinds of symptoms that are not based in reality are psychosis.
Can someone with schizophrenia get better? Is there treatment available?
Yes, there is. Schizophrenia is one of the major mental disorders that really needs to be treated primarily with medication, but also with psychotherapy as well. And there are a lot of new medications. There are some medications that have been around a long time, and there are some newer ones that have better side effect profiles, can work more quickly, are better tolerated.
It's a disorder that comes on in adolescence and early adulthood, so it can be heartbreaking to see a young adult who has been doing very well in their life and begins to withdraw from others and begins to have psychotic symptoms.
Sure. How can psychotherapy help?
Psychotherapy can help once the person's thinking is organized a bit and they've started on medication. Psychotherapy can often help them develop some daily basic life skills, help them organize their day even, help them develop some trust in people, because often that's a very tough thing for someone with schizophrenia.
And with psychotherapy, people can sometimes be able to work in supported settings, live with others, have a life where they have some recovery from the illness and are able to enjoy their lives.
I've got about 45 seconds. Maybe some of our listeners, how can they help somebody with schizophrenia?
Well, again, this is such a heartbreaking disorder, and to be able to reach out, perhaps accompany someone to go see a physician or a licensed professional, I think that's very important. Oftentimes, they need that help and support to go.
I think reaching out to somebody who you have a concern may be developing a schizophrenic illness is important, because they tend to withdraw and they tend to deny their illness, and they feel ashamed often. So reaching out to them and engaging them and helping them to get help is important.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss eating disorders.